Hi, welcome back to my channel. In this video, I will be discussing about the cavernous sinus. Basically, I will discuss only the general anatomy and the relations in a very easy way format. I've already discussed the tributaries and communications in my other video, so you can check that out from there. So first of all, let's just start from the general anatomy. So first of all, you should know that cavernous sinus, it is located in the middle cranial fossa. All right, now I want you to know this picture and see the blue shaded part, right? That is the cavernous sinus we are talking about in this whole video. Now you know that this is the anterior cranial fossa, this is the middle cranial fossa, and this is the posterior cranial fossa. So obviously it is lying in our middle cranial fossa. All right, then I want you to see that it lies on either side of, just give me a second, lies on either side of body of sphenoid bone, then extends from superior orbital fissure to apex of petrous bone. All right, now just know, you can remember if you want to, it is 2 centimeter long and 1 centimeter wide. Now see, I am talking about this. So here is superior orbital fissure. All right, so this, you remember, this is dorsum tubercle cellae, dorsum cellae, this is sella turcica, right? And yeah, so from this only I will explain the relations also. Just give me a second. um, so now let's talk about the relations. So first of all, in relations, if you observe nicely, here we have foramen lacerum, right? So, and in the medial part here we have sella turcica. All right, and here I told you that we have superior orbital fissure. So basically we will have optic nerve. Okay, but like that's not the relation that you should like. It's just a way of remembering. Over here you will have the temporal lobe of cerebrum. Okay, inferiorly you have foramen lacerum. Okay, now yeah, uh yeah, now I will draw a diagram which is more schematic and which will help you to remember it for long term. So first of all, just go through the diagram that I'm making and then we'll just talk. All right, so this is the diagram which will help you to remember most of the part of it. All right, so first of all, just know one pattern: 2, 3, 4, 5 and 6. Okay, just remember this much. Then remember one artery outside, one artery here. All right, fine. Then yeah, then yes. So first, so let's just understand it. So first of all, this is our second cranial nerve, this is third cranial nerve, this is fourth, this is fifth cranial nerve, only the V1 and V2. Now I suppose you know, second is optic nerve, third is oculomotor, fourth is trochlear, fifth is trigeminal nerve, but only the ophthalmic and maxillary division and not the mandibular division. Mandibular division is somewhere here. All right, so this is the V3 of fifth nerve. All right, so basically just remember V1 and V2 only. Okay, then this is sixth inside. All right, this is the abducent. All right, now let's just start. Now superiorly, if you see, you have optic nerve, and internal carotid artery. All right, this I'm referring to. Then laterally, I told you here, laterally what do you have is temporal lobe. Okay, so you can make it here. Lateral is temporal lobe of cerebrum. Then inferiorly, see here, inferiorly foramen lacerum. So foramen lacerum. Then medially, most important. Medially, there's no space. So medially, you have medially ये cavernous sinus है. In medial you have pituitary sella turcica, which is having pituitary gland, right? So oh my god, pituitary gland, and you have sphenoidal air sinus. This is our sphenoidal air sinus. Now the questions that you get asked. So all these are questions only. Plus there is one more question. Structures within lateral wall of sinus. So I told you lateral 3, 4, 5, right? So 3, 4, 5 का V1, V2 cranial nerve, and also trigeminal ganglion. Then another question, generic question, structure within medial aspect. So I told you this lying inside. So sixth nerve and internal carotid artery. All right, so these are the relations of cavernous sinus. I hope I made it easier for you to understand. If you like the video, do subscribe to my channel and